Well, hello everybody, and a very warm welcome to you. My name is Beck, and I am a business manager at Catholic Healthcare. It's so lovely to have you join us today for our Stay Steady and Confident at Home Falls Prevention webinar. Before we begin, I'd like to acknowledge the traditional custodians of the land on which we're meeting today and pay my respects to elders past and present. I extend that respect to any Aboriginal and Torres Strait Islander people joining us today. Today is all about helping you stay steady and safe and confident at home so you can keep doing the things you enjoy in the place you love. Thank you so much for joining us today. We're really pleased you could be here for this conversation because today we're talking about something that impacts many people living at home, falls, and how we can help prevent them, respond to them, and continue to live independently and confidently. This will be a practical and supportive session. We'll hear from a number of our clinicians and program team leads, each sharing their expertise and simple, helpful strategies you can take away. If you do have any questions as we go, please feel free to pop them into the Q&A section or the chat. We'll keep an eye on those chat and Q&A sections throughout the session, and we'll also pause towards the end to go through as many questions as we can. So please don't feel like you need to hold on to your questions. You can pop them in there and, you're welcome to add them at any time and we'll get to them. So falls are actually one of the most common reasons people end up in hospital as we get older. But the important thing to know is that many falls are preventable. Often it's not just one cause, it's a combination of small changes across time. Feeling a little less steady, moving a bit less, changes in confidence. Today is about recognizing those early changes and knowing what you can do and who can support you. I'm joined today by a few colleagues who work closely with people in the community every day. Carol Chong, our physiotherapist, Sue Murray, our occupational therapist, Gabby Courts, health and wellness coordinator, Julie Jackson, our stepping on coordinator, and Mel Morris, our clinical care partner. To start us off, I'd like to introduce our physiotherapist, Carol. Carol, can you help us understand why strength and balance are so important when it comes to preventing falls? Oh, Carol, I think you might be muted.
Hi, apologies for that.
Lovely, thank you.
So I might start with something really important to understand, and that is that our strength and balance don't stay the same over time unless we actively maintain them. As we get older, it is completely normal for our muscle strength to gradually reduce. This is something we can call deconditioning. It can happen quite suddenly, especially if we're not moving a little less than we used to. For example, if we stop doing regular walks, if we sit more throughout the day, or if we avoid certain activities because they feel harder. Over time, the muscles, particularly in our legs, can become weaker. And those muscles are incredibly important to help us stand up from the chair, climb stairs, catch ourselves if we trip, and stay steady when we are moving around the home. Balance works in a similar way. A lot of people think balance is something you either have or don't have. But actually, balance is something we can train and improve at any age. It's influenced by a few different things: strengthening your muscles, your vision, your inner ear, which helps with orientation, and how well your body responds to movement. So, when we work on strength and balance together, we're really helping the body to respond more effectively to everyday movements. And importantly, to unexpected movements like tripping or losing footing. And that's really what falls prevention is about. Not just about avoiding risk, but helping your body respond when something doesn't go to plan.
Thanks, Carol. That's really helpful. And I think that's so reassuring is that these are things that we can all work on. So before we get into what people can do, I'd love to understand some of the early signs people might notice that their balance or strength is starting to change.
One of the most helpful things I always encourage people to look out for is small changes. Falls don't usually happen out of nowhere. There are often early signs that things are starting to change. Some of the common ones we see are holding onto furniture when walking around the house, feeling a little unsteady when carrying something like a cup of tea or the laundry, taking more time to get up from the chair, feeling less confident on stairs or on even ground, or even just moving a bit slower than usual. Sometimes people also start to avoid activities like not out as much, avoiding walks, or sticking to certain areas of the home. And while that can feel like a way to stay safe, what we often see is that can actually lead to further loss of strength and confidence over time. Another really important one is fatigue. Feeling more tired during everyday tasks, that can be a sign that your body is working harder to do the same things it used to do more easily. So, if you notice any of these changes, even if they feel small, they're really important signals and they're a great opportunity to take action early.
And these are the kind of changes people can easily overlook or just put down to getting older. But as you've highlighted, they really do matter. So, thinking about that, when someone starts to notice a few of these signs, what are some simple, practical things people can start doing to build their strength and improve their balance?
Now, that good news is that this is a lot that we can do, and it doesn't have to be overwhelming or complicated. The first and most important thing is regular movement. We generally recommend aiming for around 150 minutes of movement per week, but that doesn't need to happen all at once. It could look like short walks, gentle exercise classes, activities you enjoy like gardening or dancing. The key is consistency. Alongside that, we really focus on balanced exercises. This might include things like standing in one leg with support nearby if needed, walking heel to toe, turning and changing direction safely. These types of movements help train the body to adjust and respond, which is exactly that helps prevent falls. Then we look at strength building exercises, particularly for the legs, like sit to stand from a chair, step ups, gentle resisting exercises. These help building the muscle that support everyday movement. And importantly, all of this can be tailored to the individual. That's where working with a physiotherapist can be really helpful. We can assess where someone is at and develop a program that feels achievable and safe for them.
Thank you. And then for someone listening today who might not be very active at the moment, where would you suggest that they start?
I'll say start small and keep it realistic. It might be a short walk, some simple sit to stands from a chair, or just building a bit more movement into your day. It doesn't have to be anything extreme to make a difference. The important thing is doing something, and then building from there.
That's really reassuring. It doesn't have to be anything extreme, just small, consistent steps. Alongside that, I know there are also some common factors that can increase the risk of falls. What are some of the most common risks you see that can contribute to falls?
There are a few common factors that can increase the risk of falls, and it's helpful to be aware of them. One of the big ones is medication. Some medication can cause dizziness, drowsiness, or changes in blood pressure. So if you notice any of those symptoms, it's really worth having a conversation with your GP or pharmacist. Another really common one is footwear. We often see people wearing slippers without grip, loose fitting shoes, or shoes that are worn down. Ideally, footwear should fit well, have a non-slip sole, provide good support. Even small changes here can make a big difference. And lastly, fatigue. When we are tired, our reaction time slows. Our muscles don't respond as well, and we're more likely to lose balance. So pace yourself. Taking breaks and listening to your body is really important. Staying active is one of the most powerful things you can do to reduce your risk of falls. It supports your strength, your balance, your confidence, and your overall well being. And the earlier you start, even with small steps, the bigger the difference it can make over time. So it's not about doing everything at once, it's about doing something and building from there.
And something you mentioned that may be something we often don't think about, but can make a big difference is footwear. Can you talk us through what we should be looking for in a good supportive shoe and what to avoid?
Absolutely. And this is one of those things that can have a really immediate impact. We often see people wearing shoes that feel comfortable but don't actually provide much support or stability. Things like loose slippers, thongs, or open back shoes, worn out soles, or shoes that don't fit quite properly. This can all increase the risk of slipping, tripping, or losing balance. When choosing footwear, there are a few key things to look for. Number one, good grip, a non-slip sole, something that won't slide on tiles or wet surfaces. Two, secure fit, a shoe that stays firm on your foot, ideally with laces, velcros, or a strap. Three, support, a firm heel, not soft or floppy. Good support around the ankle and midfoot. Four, low heel. Flat or very low heel is best for stability. Five, wide and comfortable fit. Enough room in those toes areas, not tightening or squeezing. One of the big things we see is people being careful outside, but then wearing less supportive footwear inside the home. So it's really important to think about what you're wearing indoors as well. Even something as simple as switching from loose slippers to a supported shoe can make a noticeable difference. It might seem like a small thing, but the right footwear can improve stability, reduce the risk of slipping, and help you feel more confident when moving around. So it's definitely one of the easiest and most effective changes people can make.
I think something else that's really important to talk about is what happens after a fall. We've spoken about prevention and early signs, but if a fall does happen, it can feel quite unsettling and people aren't always sure what to do next. So I'd love you to talk us through how physiotherapy can support someone after a fall, both immediately and in the longer term.
Yes, a fall can be quite a shock, even if there's no serious injury. The first priority is always safety, taking a moment before trying to get up, checking for any pains or injury, and calling for help if needed. Even if someone feels okay, it's still really important not to just move on and forget about it, because a fall is often a sign that something has changed. One of the biggest things we see is people having a fall and thinking, I'm okay, I'm just be more careful next time. But what we know is once someone has had a fall, the risk of another fall increases. So that follows up is really important, not just to treat anything physical, but understand why the fall happened. When we see someone after a fall, we start with a really throughout assessment. We look at things like strength, particularly in the legs, the balance and stability, their walking pattern or gait, confidence with movement, any dizziness or changes in coordination. We also talk through what happened, where the fall occurred, what the person was doing at the time, were there were any contributing factors like fatigue, rushing, or environment. This helps us build a full picture of what may have contributed. From there, we develop a personalized plan. That might include strength and balance exercises, strategies to move more safely, gradual return to activities. A big part of this is to rebuild confidence. Because after a fall, it's very common for people to feel hesitant or fearful. And that can lead to doing less, which actually increases risk over time. So we support people to safely build back up again. We also teach really practical skills, such as how to safely get up from the floor, how to move confidently around the home, and how to manage situations like stairs or uneven grounds. These are things that can make a huge difference in everyday life. Physiotherapy is often just one part of the support. We may also link it with occupational therapists for home safety, GPs for the medication reviews, other services or programs like Stepping On. It's really about making sure all the pieces are working together to support that person.
And I think that's a really important takeaway. It's not just about the fall itself, but understanding what's changed and putting the right support around that. And really, that's where all of these services come together to support people not just to recover, but to feel confident again. Thank you so much, Carol, for that. That really brings to life how important strength and movement are. And alongside that, something we often don't think about is just how much our home environment and daily routines can either support us or increase our risk. So I now love to bring in Sue, our occupational therapist, to talk us through how small changes in the home and in the way we do things day to day can make a really big difference to safety and confidence.
Hi, everyone. So one of the key things to understand is that most falls actually happen in and around the home. Often it's not because something major has gone wrong. It's usually a combination of small environmental hazards, changes in how someone is moving, and the way everyday tasks are being done. So over time, these things can add up. So what we focus on in occupational therapy is helping the home and daily routines work with the person, not against them, because the goal is always to support people to stay independent, safely and confidently in their home. When we look at the home environment, there are some really important common risks we often see. These include loose rugs or clutter in the hallways, poor lighting, especially at night, steps or uneven surfaces at entry points, bathrooms without support rails or non-slip surfaces, reaching or bending for frequently used items. Individually, these might seem minor, but together they can significantly increase the risk of a fall. So often people adapt without realizing, for example, taking a different route through the house, avoiding certain areas, or feeling less confident in particular spaces. That these are really important signs that something in the environment may need to change.
Thanks, Sue. And alongside those practical changes in the home, there are also some really helpful devices and supports that can make everyday life a bit safer and more manageable. Could you talk us through some of the types of supports or equipment that might be helpful and how they're used in practice?
This is often where people are surprised about how much difference the small supports can make. When we talk about helpful equipment and supports, it's not about taking away independence. It's about making things easier, safer, and more comfortable to do on your own. Some of the most common supports we might recommend include bathroom supports, grab rails in the shower or near the toilet, shower chairs or benches, and non-slip mats. The bathroom is one of the highest risk areas in the home, so even small additions here can significantly reduce the risk. Mobility and support aids, walking sticks or frames properly fitted, bed rails or supports for getting in and out of bed, chair raisers to make standing easier. These supports can reduce strain and help people move more safely through the day. Personal safety devices like personal alarms or pendants, wearable alert systems. These are particularly helpful for people who may be alone at times. They provide peace of mind knowing that help is easily accessible if needed. Home modifications like handrails on stairs, ramps at entryways, and improved lighting. Even small modifications can make a home more accessible and easier to navigate. Practical everyday supports like reaches or long-handled aids. Equipment to reduce bending or stretching, kitchen or dressing aids. These are all about making daily tasks easier and reducing strain or risk.
And something else that often comes up, particularly for people who might spend time at home on their own, like you mentioned, is that sense of what if something does happen? So, could you talk us through some things like personal alarms, like you mentioned, or emergency call systems, and how they can support people to feel safe and more confident at home?
So devices like personal alarms, they have different brands like Live Life Alarm or Vital Call. A personal alarm or emergency call system, also they're sometimes called Vital Call or Pendant Alarm. They can make a really big difference, especially for peace of mind. They're usually worn around the neck, like on a pendant, or around the wrist. With the press of a button, on the middle of the device. The device is quite small. It's sort of like around this kind of size. So they're not heavy. They're quite easy to wear. With the press of a button, the person can call for help immediately. So depending on the system, that might connect to a family member or a neighbor or a monitoring service, like the Vital Call will go, it's a calls to the base, or emergency support. So you put in the number that you want. So you put in the number of your neighbor or your family member, or the name of the number of the emergency support number, and it will connect automatically to that. So they're not just about emergencies, but it's about building confidence for you. So, for example, someone might feel more comfortable having a shower, knowing then they can call for help if they need it. Or if they fall, they can call that. It also has a fall detection on that, so it can automatically call that number or those emergency contacts that you have on there. So it helps you to feel more confident moving around your home and even staying in your home for longer, living independently at home. So we see a big benefit for family members who also feel reassured knowing there's a safety net in place. We might suggest a personal alarm when someone has had a fall or is at higher risk of falling or lives alone or spends any time alone or feels anxious about what might happen. But again, it's not about waiting for something to go wrong. It's really to be proactive, a proactive step that supports your independence.
That's really helpful. Thank you, Sue. And what are some of the signs you look for that suggest someone might be starting to need a bit more support at home?
So often before a fall happens, we start to see changes in how someone is managing daily tasks. And this might look like taking longer to do tasks that you've been doing for a long time quite quickly, feeling more tired during routine activities, avoiding tasks like showering or cooking or going outside, or needing holding onto things in the house for support. We kind of call that furniture surfing because you're going from one piece of furniture to another. So these changes are really important because they're usually early indicators that something is becoming more difficult. And again, they're often easy to dismiss or adapt around. But this is where we can step in early and provide strategies to make those tasks easier and safer.
And I think hearing that, a lot of people might recognize some of those small changes in themselves. So, what does support from an occupational therapist actually look like in those situations?
So, after a fall, occupational therapy can play a really important role. We often come into the home and look at what happened during the fall, where it occurred, and what might have contributed. So, like in the environment, what might have contributed, or was it fatigue, or were you tripping over something? So, from there, we can recommend changes to the environment or suggest equipment or modifications. Provide strategies for safer movement and task completion. So it might be a chair that helps you to. It's a recliner chair that will actually you use a remote control to help you to stand up from after sitting down. It's a sit to stand chair raising device. Adaptation for the recliner, or it might be a bed rail for the height adjustable bed. It might be rails in the bathroom, in the shower, on the toilet. It might be a chair, a shower chair. Maybe it's better to be sitting down to complete showering rather than standing up. So we also support people to regain confidence in their homes because after a fall, it's very common to feel unsure or hesitant, particularly in the space where the fall happened. So part of our role is helping people feel safe and confident returning to their normal routines. As the physiotherapist said, occupational therapy is also part of a broader support team. We work closely with physiotherapists, care teams, families, and carers. And we make sure that the person is supported from all angles, not just physically, but in how they live day to day. Because ultimately, it's about helping people continue to live the life they want in the safest way possible.
And I think what really stands out is that it's not about making big, overwhelming changes. It's about small adjustments that help you feel safer and more confident in your home. We're now going to move into one of our structured programs that brings a lot of these elements together. Thank you so much, Sue. That really brings together how important both movement and the home environment are in reducing the risk of falls. What we often see is that once people start to notice these changes, or even after a fall, it can be a bit overwhelming to know where to start. So I'd like to now introduce one of our structured programs that brings all of this together in a really practical and supportive way, the Stepping On program. This program is specifically designed to help people build strength, improve balance, and most importantly, feel more confident in their day-to-day lives. Julie is our Stepping On coordinator and is here to talk us through what the program involves and how it supports people to stay steady and independent at home.
Hi, everybody. The Stepping On program is a 7-week evidence-based falls prevention program designed especially for people living at home who want to improve their strength, balance, and confidence. What's really important about this program is that it doesn't just focus on exercise. It looks at the whole picture of falls prevention. Over the 7 weeks, we cover a range of really practical areas, including strength and balance exercises, understanding what increases your risk of falls, how to make your home safer, the impact of medications and vision, and strategies to stay active and independent. We also bring in guest speakers, such as physiotherapists and occupational therapists, so participants can hear directly from the different experts. A big part of the program is actually practicing movement in a safe and supported way. We guide people through exercises that improve your leg strength, build that balance, and help the body respond more effectively to movement. But importantly, we also focus on building confidence with movement, not just the physical side of things.
And that confidence piece is something we've touched on a few times today. It really does make such a difference. Can you talk us through how the program helps people build that confidence over time?
Yeah, sure. One of the biggest things we see is the fear of falling. After a fall, or even after feeling unsteady, people can become more cautious, which is completely understandable. But what can happen is people start to do less, avoid certain activities, or limit their movement. And over time, that can actually increase the risk of falling. So a big part of Stepping On is helping people rebuild that confidence in a safe, gradual way. And doing that in a supported environment makes a big difference. The program is delivered in a group setting, and that's incredibly valuable. Participants often say they feel encouraged by others, they realize they're not alone, and they build motivation to keep going. That's a real sense of shared experience, which helps people stay engaged and committed.
And I know one of the really practical things you cover in the program is how to safely get up after a fall, which I think is something many people can worry about. Would you be able to give us a bit of a teaser of that part of the program and talk us through this really helpful approach?
One of the most valuable real-life skills we teach in the program, and often one of the most reassuring, is how to safely get up after a fall. This is something many people worry about, especially if they live alone, and often it's something they've never actually been shown how to do. So what we do in the program is we break it down into really simple, manageable steps. The first thing we always say is take a moment and don't rush. Stay calm, take a breath, and check your body for any pain or injury. If something doesn't feel right, it's really important to stay where you are and call for help, because trying to get up too quickly can sometimes make things worse. If you do feel okay to move, the next step is to roll onto your side. This helps you avoid straining your back and gives you a more stable starting position. From there, gently push yourself up onto your hands and knees, and then crawl or move towards a stable piece of furniture, like a chair or a couch. Having something sturdy to hold on to is really key here. Once you're at that chair, place your hands on the seat. Then bring one foot forward so you're in a kneeling or a lunge position. This is a really strong, stable position to work from. From there, push up using both your arms and your legs. Take your time, there's no rush. And then importantly, sit down and rest. Even if you feel okay, it's really important to pause, catch your breath, and check in with how your body's feeling. In the Stepping On program, we don't just talk through this, we actually practice it together in a safe, supported environment. We break it down step by step, adapt it to suit each person, and give people the chance to build confidence doing it themselves. Because it's one thing to hear it, but it's very different to actually feel confident doing it. And what we often hear from participants is that this is one of the most valuable parts of the program, because it changes the thinking from what if I fall and I can't get up to if I fall, I know what to do. And that shift is incredibly powerful. It reduces fear, builds confidence, and helps people feel more in control, which is such an important part of staying independent at home.
Thanks, Julie. And then, so for anyone listening today and wondering whether this might be the right program for them, who is the program best suited for?
The program is designed for older people living independently at home or in the community who are able to walk on their own with or without a walking aid, and who may have had a fall in the past year or feeling a little less confident about falling. To help everyone get the most out of the program, it's best suited to people without significant cognitive or complex neuromuscular conditions. The program is available for people aged over 65 and for Aboriginal and Torres Strait Islander people aged 45 and over. Overall, it's ideal for people who are living independently and would benefit from practical support to build strength, confidence, and balance.
Thank you so much, Julie. That's such a practical and empowering program. And I think what really stands out is that it's not just about reducing risk, it's about helping people feel more confident and capable in their everyday lives. But we also know that staying active and building confidence doesn't always have to happen in a structured program. So I'd love to now bring in our Mind and Move coordinator, Gabby, because this is a really wonderful way people can stay active, connected, and engaged in a way that feels enjoyable. Gabby, can you talk us through what Mind and Move is all about and how it supports people to stay steady and confident at home?
Of course. So, Mind and Move is a wellness and lifestyle program designed to support people to stay active, connected, and engaged in ways that makes them feel that is enjoyable and meaningful. What's really special about Mind and Move is that it can offer a wide variety of activities, so people can choose what suits them best. That might include exercise classes, walking groups, dance or movement sessions, social outings, or creative activities like art and music. So it's not just about exercise, it's about supporting the whole person. We know people are much more likely to stay active if they're enjoying what they're doing. If something feels like a chore, it's much harder to keep it going. But when people enjoy the activity, look forward to it, they feel more connected to others. They're much more likely to stay consistent, and that's where the real benefits come from.
And that consistency is what really makes the difference over time, isn't it? So how do you see that impact people's strength, balance, and confidence as they keep attending?
Yes, and we see some really positive changes. Through regular participation, people often experience improved strength, better balance, increased mobility, and a greater confidence in movement. Everything, even things like feeling steadier walking, getting up more easily, or feeling more comfortable getting out and about. These are all really meaningful changes, but just as important is the social side. Many people have said that they enjoy seeing familiar faces, they build friendships, and they feel a sense of belonging. And that connection has a big impact on confidence, mental well-being, and motivation to stay active. It helps people feel more engaged in life, not just physically but socially as well. One of the great things about Mind and Move is that it's very flexible. There are different types of activities, different levels of intensity, and options to suit different abilities. We also help people find activities near them, explore funding options, and even organise transport if needed. So we really try to remove any barriers to getting involved.
And for someone who might be listening and thinking this sounds great, but I haven't done anything like this before, what would you say to them?
That's something that we hear quite often. What we always say is you don't need to be fit or confident to start. That's exactly what the program is there to support. People can start at their own pace, do a free trial session, and build up gradually. It's a very welcoming and supportive environment. Staying active can be enjoyable, social, and something to look forward to. And when it becomes part of your routine, it can make a really big difference to your strength, confidence, and overall well-being.
Thank you, Gabby. That's such a lovely way to think about it. And I think what really stands out is that staying active doesn't have to feel like something you have to do. It can be something you genuinely enjoy and look forward to. And when that happens, it becomes much easier to keep going, which is where we see those long-term benefits. I think what we've really seen throughout today is that there are so many different ways to support your strength, balance, and confidence, whether that's through programs, movement, or small changes at home. But alongside all of that, there are also supports and services that can help you feel reassured, supported, and confident in your day-to-day life. I think sometimes when people hear about services or support, it can feel like it's only something you access when things have gotten quite difficult. But actually, these supports can be really helpful much earlier than that. They can absolutely assist if your health is changing or you're finding things a bit harder, but they can also be there simply to give you confidence and reassurance, to know someone is there, someone is keeping an eye on things, and you're now managing everything and you're not managing everything on your own. And that can make a really big difference to how people feel day to day. Mel is our clinical care partner. Mel, from your experience, what do these kinds of everyday supports actually look like in real life? And when people first start exploring support, what are some of the most common areas they're looking for help with?
I think that's such an important way to frame it. Often when people hear about support services, they assume that it's something they only need when things have become quite difficult. But in reality, many of these supports are most helpful earlier on, when things are just starting to feel a bit harder, or when confidence isn't quite what it used to be. Because they're not just about helping with tasks, they're about helping people feel supported, reassured, and more confident just in their day-to-day life. One really good example of this is something like shopping. For many people, shopping just isn't about getting groceries. It's a part of their routine, their independence, and often a social outing as well. But over time, it can become more challenging with walking longer distances or navigating busy spaces or just carrying the bags. So rather than taking that away, we often support people to keep doing it, just with a little bit of assistance. And that might look like going together to the shops or helping them carry their items or just providing a steady presence for confidence. And what we often see is that people really value that because they're still making their own choices. They're still getting out of the house, just with that little extra layer of support. Similarly, transport can become a barrier for many people, whether it's just getting to appointments or attending programs like our Mind and Move program, or simply just visiting the shops or seeing friends. And if it feels difficult, people may start to go out less, which then impacts both their physical and their social well-being. So having that support with transport can really make a big difference. It's just not about getting from A to B. It's about staying connected, maintaining routines, and just continuing to engage in life outside of the home. And at home, we often see that it's the everyday tasks that can start to feel more tiring or harder to keep up with. Under the Support at Home program, help with household tasks is generally focused on helping to maintain a safe and livable home environment. And this might include things like light cleaning, vacuuming and mopping, laundry, or just basic household upkeep. So it's really about supporting the home to stay safe and manageable and also comfortable to live in. And it's also very important to mention that the level and type of support can vary depending on individual circumstances and funding. So it's not about doing everything. It's about providing the right level of support to maintain safety and well-being at home. And for some people, there may also be support with more personal routines, such as assistance with showering or getting dressed, or just generally the daily preparation. And I think it's very important to say that this is always done in a way that supports your dignity, respects the independence, and works at the person's pace. And it's about making those daily routines feel safe, comfortable, and manageable.
Thank you. And when you step back and look across all of those supports, it's not just the practical help, is it? There's a real sense of reassurance that comes with it.
Absolutely. So when you look across all of these supports, what really stands out is that they're not just practical, they provide reassurance. So the sense that someone is there, someone can step in if you need, and you're not managing everything on your own. And that can have a really big impact on how people feel. And we often see people become more confident and more willing to stay active and just more comfortable continuing their routine because they know that the support's there if they need it. And often people say it's not necessarily that they can't do all these things, it's about choosing where they want to use their energy. So just having a bit of support can mean less physical strain or less fatigue, and then more energy for those things that they enjoy or value the most. And just to add, we've spoken about a lot of supports today in terms of doing things with somebody, like accompanied shopping or getting out together. But it's also absolutely okay if you prefer support to be done for you in certain areas. Everyone is different. Some people really value that independence and want to stay involved, and others might prefer to step back from certain tasks. And both are completely okay. The support is there to work around what feels right for you.
Thank you so much, Mel. That's such a helpful way to bring it to life. And I think that really stands out is that it's not about losing independence. It's about having the right support in place to keep it. So I might just pause here and open things up for questions. If you do have a question, you can type it in the Q&A section on the screen or the chat section. You should see a little button that says Q&A or chat. If you click on that, there'll be a space where you can type your question and send it through. So I'll give a few minutes for that if anybody had any questions that they wanted to ask.
Beck, we do have a question from Gwen. They said, if I feel myself falling, what should I do?
Thanks, Beck. Just thinking, Carol or Sue, you might be the best to answer that one. Did either of you want to step in with that answer?
Well, I would just say, if you feel that you're falling, you just have to fall, try to, some people would just put their hands out, and that's the risk of having a fracture, As I always say to my clients, look, we all fall, from babies to kids to us. I fall. We all fall, but it's all about what is the impact. So it's also the luck, the little kids can also break their bones, so older people are a higher risk when they fall, is because, as I said, less strength, less balance, and also their bones have, they're more brittle, they're more delicate. You could have fallen and nothing could have broken, because it's, the angle, or you have muscles that's important. When you have really strong muscles, sometimes those muscles are so strong around the bones and that they protective, it's not about being overweight, it's about the strength of the muscles. Okay, so if you feel like you're gonna fall, try to fall the best that you can with the less harm. In our perception, we always gonna try to protect our face, that's normal. So yeah, you can try that and hopefully you don't break, but it's, yeah. Or maybe with doing exercises and balancing, your proprioception can just put the leg out like a ninja, and you didn't fall. That's why exercises, it's important. Doing the tandem walk is important. Sometimes even without thinking, you lose your balance and you just react, so we all fall. It doesn't matter the age, it's just that older people are more have brittle bones, so that's why it's easier for you to have more injury, and it affects your confidence after all. So it is important to do exercises, balance exercises, and strengthening exercises. I hope that makes sense. Sue, do you have any recommendations that you can give? I don't, that's from my perspective, if that happens.
Thanks, Carol. I think that's really helpful. And I think, that emphasizes that if a fall is going to happen, it's likely going to happen, but it's about how we react after that fall as well. Thanks, Carol. And thank you, Gwen, for that question.
There are a couple more questions, Beck. Can an exercise program be designed for an individual to do at home rather than a group setting?
Fantastic, yes. Carol. Yeah, are you happy to answer that one?
Yeah, sure. Yes, certainly. That's part of our work with Catholic Healthcare. We provide home physiotherapists with our team, with the physios and the allied health assistants, to give a personalized, a specific home exercise program that can teach you for the rest of your life, So it's about maintaining the balance to improve or maintain the leg strengthening. So it's exercise is really important for our rest of our lives. So yeah, we can certainly do some exercises or some assessment. We do an assessment first to see what is your capacity, and then we talk to you about what are your goals. Maybe you're struggling to go up the stairs. You feel a bit fatigued when you reach the stairs. Maybe you're struggling getting out of the chair. Remember, it's important to stay at home. I would say always it's important to get up from the chair independently. If you lose that capacity and we need to have manpower, that's where other other things that we have to put in place. But it is important to maintain the ability to get up from the chair, go to the toilet, get up from the toilet, come back to the chair, mobility and independence, but yeah.
Fantastic. Thanks, Carol. And we're a bit tight for time. We can probably do one more question, and then any of those questions that we haven't answered, we'll do our best with a follow-up email to address those.
Yeah, one of it is Becca calendar for Stepping On Mind and Move. We'll be sending a link to the website to participants as part of that. I think the other ones we can go individual to those questions.
Yeah, fantastic. Thanks, Anna. Did Gabby or Julie have anything that you wanted to add about that in regards to Stepping On Mind and Move? Calendars? Nope.
Yeah, we can send those individuals the calendar and the dates and things like that.
Yeah, brilliant. Thank you. Lovely. Oh, thank you so much, everybody, for those questions. Just before we finish, I'd really love to take a moment to acknowledge anyone joining us today who might be supporting a parent, partner, or family member or friend. You might be noticing some of these small changes we've talked about, things like confidence, balance, or day-to-day tasks becoming a bit harder. And often that can feel tricky because you want to help, but you might not be quite sure how to bring it up in a way that feels supportive, but not confronting. So Mel, what guidance would you give to someone in that situation or that position, and how can they start the conversation in a gentle and supportive way and help their loved one feel comfortable exploring support?
Yeah, such a great question, because it's something that we hear a lot. And one of the most helpful things is to start from a place of care and support rather than of concern or worry. So instead of saying, I'm worried about you, you might be able to turn it around and sound more like, I've noticed things that might be feeling a little bit harder lately, like how are you finding things? And that generally just opens up the conversation rather than making someone feel like something is wrong or that they're not coping. And it's really important to keep it collaborative rather than suggesting solutions straight away. Try asking questions or just listening, and trying to understand what matters most to them. Because people are much more open to support when they feel heard and in control, but also be a part of that decision. And another really helpful approach is to focus on what the person wants to keep doing. So, for example, staying in their own home, getting out and about, or just keeping up with routines. And then just framing the support as something that helps them to continue doing those things. So it becomes, this could help you keep doing what you enjoy, rather than you need help. Sometimes it can help to introduce support as something small or just on a trial-based period. For example, what if we just tried it once or tried a session, or we could explore this together? So taking that first step can often feel like the hardest part, but it's just really important to normalize it. And support is something many people use. It's not a sign that something is wrong. It's just about staying safe and confident and independent for longer. So I think the key message is start small, keep it positive, and focus on what matters to the person. Because when they feel supported rather than pushed, they're much more open to accepting the help.
Thank you so much for that, Mel. That's such a thoughtful and practical advice. And I think that's a really important reminder, whether it's for yourself or someone you care about. These conversations don't have to be difficult. They can be about supporting independence, staying connected, and making sure the right support is there at the right time. Thanks again. And thank you again to all of our guest speakers today for sharing your knowledge, your experience, and such practical advice. I think what really stands out from today is that staying steady and confident at home isn't about one big change. It's about small changes, noticing changes early, and having the right support around you. We've talked about building strength and balance, making small changes in the home, learning practical skills, staying active and connected, and the different supports available. And when you bring all of that together, what it really creates is confidence, reassurance, and the ability to keep doing the things that matter to you. And I think one of the most important messages to take away is you don't have to wait for something to go wrong to put support in place. Support can be there early to make things easier, to keep your peace of mind, and to help you stay independent for longer. Whether that's joining a program, making a small change at home, or simply having someone there to support you. Even small steps can make a really big difference over time. And if you're someone supporting a loved one, just starting that conversation gently and positively can be such a powerful first step. If anything we've talked about today has stood out to you, we'd really encourage you to take that next step, even if it's just exploring what's available. You don't have to figure it all out on your own. There are people who can guide you through that, which might be helpful based on your situation.